Greetings to you from claimsbazaar.com. This is a case regarding portability from New India to Star Health and Health Insurance Company Limited. Also, we find that the claim was repudiated on the basis of non-disclosure of material fact in the proposal form regarding pre-existing diseases. Now, Mr. Kadirvelu of Coimbatore had taken a policy with New India Insurance Company Limited since 2005. He ported it to Star Health and Allied Insurance Company on 8/3/2021 since his wife was an agent in Star Health since 2018. The policy was granted continuous coverage from 8/3/2017. So this is the facts of the case. In the year 2021, July 2021, the policy was ported in March 2021. Mrs. Kadirvelu suffered from severe abdominal pain and was taken to the hospital in July 2021, where it was found that she had a heavy, bulky uterus and mild fibroid symptoms, which was treated as an outpatient, and she was sent home. She suffered from a similar bout after 9 months in April 2022, and it was found that her periods had become irregular. Uterus was again bulky and the bleeding did not stop. So again she was treated on medication and was sent home. But however, in February 2023, she went the third time when she went to the hospital. It was decided to have the surgery done, uterus to be removed. The papers were, pre-authorization papers were sent. Insurance company authorized it initially. Subsequently, when all the final papers were sent, they withdrew the pre-authorization, stating that the claim was pre-existing, that she had been having it for more than 4 years as per the report in the discharge summary, and hence they repudiated the claim. Now Mr. Kadirvelu came to Claims Bazaar and with his request for assisting him in this claim. So we went through all the papers and found that the policy was issued in 2021 with coverage from 2017, and the disease was identified only in July 2021 for the first time and not prior to that. So the policy was ported in March 2021. Disease identified only in July 2021, which is after porting of the policy. And the case sheets and the papers, all the required papers, we made a representation to the grievance cell of Star Health and Health Insurance Company. They went through everything, but however they decided to again repudiate the claim. They said we cannot overrule repudiation, and hence Claims Bazaar, we took the claim to the Ombudsman. The Ombudsman studied the entire details that we have given, that we had mentioned that in the grievance that the policy was ported in 2021 March. The disease was identified only in July 2021, and that when they had mentioned in July 21 that she was suffering from severe bleeding for the past 4 years, it was found that it is common for all women that excessive bleeding could happen for certain women, and that she was no different, and it was only a common case. This was mentioned to the Ombudsman, and the Ombudsman, on seeing all the papers and the indoor case papers that we had sent, he had given an order stating that this claim has to be paid and there is no non-disclosure of material fact in the proposal form. For two reasons. One is the disease itself was identified only in July 2021. Thereafter, the order has been pronounced and the claim has been settled for an amount of 85,000 rupees. The total claim was 1,02,000 something, and the claim has been settled for 85,000 rupees. So these sort of cases are being dealt with Claims Bazaar. we have found a success in this policy, especially a ported policy, and we also find that there is no non-disclosure of material fact. So this, even though the same was even though the same was mentioned to the grievance cell, they did not consider it then, but the ombudsman really considered that point, and we have won this case for Mr. Kadirvelu. Thank you for listening to this. If you have any other claims, if you know of any claims which need such assistance, please do call us on claimsbazaar.com.